informed part, because the question doesn't need to be.
Welcome to the Breaking Burnout for Nurses podcast. I'm so excited to have Eva back with us today. She was in a couple of other podcasts, and she talked about yoga for non-bendy people, which is me. I'm non-bendy. And then also she did an episode with us on yoga according to your zodiac sign. So that's a really amazing and very interesting. You got to check that out. Okay, but today she's going to talk about trauma-informed concept. And so let me just back up a little bit. So she is the founder of Eva Zee Wellness, and she's been in healthcare for a long time, and is also worked in the critical care for over 10 years. And then from there, she became a yoga therapist and specializing in adaptive trauma-informed yoga. So first of all, welcome, Eva. And so I have this question, a couple of questions. I have many questions.
Yes.
First of all, what is the difference between a yoga teacher and a yoga therapist? Because I've taken a yoga class before, and it's my yoga teacher. And so I don't know, a therapist sounds a little bit more in depth. What is the difference?
A great way of putting it. So a yoga teacher, depending on the type of knowledge and experience, training that they've received, the basic training of a yoga teacher is a 200-hour yoga teacher training. And it goes through the 8 limbs of yoga, how to teach the movements, how to teach a class, and understanding the philosophies of yoga and why we use the postures, the breath work and meditation, the mindfulness component, how to put them together to teach a yoga class. And there's so many amazing yoga teachers out there that have this level of knowledge, that have years and years of experience, that are just absolutely phenomenal. And then the next level of yoga teacher training is the 300. And this can be very yoga specific, where it's a particular style of yoga, a particular lineage of yoga. And again, it's diving deeper into what is yoga and how do we apply it in our everyday life? How do we become a more experienced, more knowledgeable yoga teacher to apply yoga in a lot of different ways? A yoga therapist takes it a step further and incorporates how to integrate yoga into so many aspects of health. How does it optimize wellness by utilizing the different philosophies, the different practices, the different theologies? Well, not let's zip that last word there.
Retract that one.
Yeah, we're going to go take a step back, because yoga has so many amazing qualities of it. And how do we take yoga and apply it so that it's medicine? It's integrated into how we are moving, how we're breathing, how we're sleeping, how we're eating, how we're interacting with others, but also how we're interacting with ourselves. And it really makes it very person specific as to what does this individual need, or if I'm working with a group of people, what is going to be most nourishing, most beneficial, what's going to help to alleviate suffering and increase wellness. And that can be done in a lot of different ways, depending.
Oh my gosh. I'm just thinking of my nurses. Like, nurses need this. They need Eva.
The amazing thing is we're starting to get a lot more integrative medicine departments in hospitals, and integrative medicine, they have yoga therapists on staff. And they're part of the care team. They're part of the rounding team every day that looks at what does this patient need for their whole health. How are we going to increase patient outcomes, improve patient outcomes by providing accessible, inclusive, sustainable practices that help to optimize wellness?
Wow. I didn't know that they have that.
Yes. And there's so many ways that yoga and yoga therapy are being utilized out in the world. It's absolutely amazing. There was a study that was done in Pennsylvania that the Children's Hospital was using a program that was designed by a integrative health care team to increase nutrition, increase healthy lifestyle choices, to increase movement, but also connectivity and support systems for the improvement of children and their families from grade school on up into life. If you want healthy adults, we need to have healthy children. We need to have healthy patterns.
Okay, wow. So now how does this relate to that trauma-informed concept that we were talking about? It all intertwines, doesn't it?
It does. It really does. And as a yoga therapist and a nurse, trauma-informed care, trauma-informed language really should be utilized when we think of the ultimate nurse. We all think of Florence Nightingale, right?
Mm-hmm.
When we look at her, we think she had the ultimate patience. She was advocating for her patients. She was advocating for nursing, advocating for medicine. She was trying to improve the profession of nursing because she saw certain components happening and thought we can do better. And there's a lot of places in which nurses get tired, nurses get burnt out, and it's not our best self that shows up in how we're interacting and how we're communicating.
Right.
So trauma-informed language, trauma-informed communication, trauma-informed care, this applies to whether you're a yoga teacher, yoga therapist, a nurse, a doctor, a physical therapist, a respiratory therapist. How we interact with our clients, how we interact with our patients is helping them to feel seen and heard and believed, right? So it's changing the way that we language things. And instead of saying, oh, this is just the way that it's always been, we're thinking, no, we can be better. We can do better. We can be kind and compassionate. And in all of this, there are certain concepts that are very, very grounded in trauma-informed care: honesty, transparency, choice, acceptance. And so this takes the role of, okay, I'm getting screamed and yelled at by a family member. Let me take a moment. Let me step back and let me look at what are they going through right now? What are they experiencing? What's the state of their nervous system? And recognizing, okay, this is a person that was woken up in the middle of the night because their family member, their loved one, was having a medical emergency. They're still in their pajamas and they're frustrated because people are speaking medical jargon to them. They have no idea what's going on. They have no idea if they're going to be excused from work tomorrow. They have no idea how to figure out how to navigate getting their kids to school tomorrow and being here to hear everything that's going on. They're scared, they're tired, they're frustrated, they're having the worst moment of their life, and they don't understand the language that's being spoken. And then when we walk in and we say, okay, we're just going to do this, and we're rushed because, the other patient over there, we're 5 seconds from coding that patient, and we're running in real quick because we need to do these tasks, and we're not kind, we're not compassionate, we're rushed, we're focused on doing the task, and we're not being completely transparent. We're not taking the time to look them in the eye and say, this has got to suck. I'm so sorry this is going on for you. I'm coming in to do X, Y, Z. And then I'll be across the room with a patient that's a little more critical. However, I do have eyes on your loved one. I do hear what's going on in here. I do see him on the monitor, and I'm only a few feet away. So if you need anything, I'll be back in half an hour. If you need anything before then, if something happens and it doesn't feel right, say something to me. That
Yes.
moment right there, all of a sudden they feel seen, they feel heard. And it's not something that's new to nursing. It's just we're so burnt out, we're not doing it for ourselves. And we sure are not doing it for our patients' family members, because we are dysregulated. So trauma-informed care is recognizing that every single person is or has experienced some level of trauma that is dysregulating or has dysregulated their nervous system. So everything that a person does, says, behaves, stands is happening through the lens of what's the state of their nervous system and how do I meet them where they are? And understanding that when a person is highly sympathetic nervous system activated, their prefrontal cortex has gone offline and their executive function has disappeared. It has left the building. I can say the same thing to them 15 times.
Yeah.
None of it's going to register.
Another thing too, Eva, and I like the way you were wording that about letting them, making them feel heard and that they're cared for, even though they know you're letting them know that you're busy with a critical patient, but letting them know that you're not forgetting about them. And if they need anything, you're right there. So just to let them know that you realize that, they're nervous and they're scared and they want to know what's going on. And another thing too is a lot of times it's besides just our medical jargon that we sometimes we forget, and we'll say some phrases that are just, we know exactly what we're talking about, but we forget to say it in layman's terms. But another thing too is a lot of times there's cultural differences where people, we might not understand what they need to hear, or, maybe they don't like eye contact, or maybe they do need eye contact or physical touch, and that sort of thing too is something that we need to be aware of, and we forget about it because we're so busy and we're in a rush to get our tasks done. So sometimes we have to back up and oh, wait a minute. Sorry, I need to explain this to you. And so I love the way you worded that.
And, we have these systems built into healthcare in a lot of different ways. And I don't know if you've noticed this, that as we have been at the bedside a lot longer, nursing education has changed a little bit in the way that they are educating newer nurses, and we have different generations, and
Yes.
the language and the understanding is a little bit different.
Yes,
This is when I was a phlebotomist, the hospital that I worked at had a particular culture. Then we had a large population of this particular culture living in that city's area. And if we had a new mom who had just had a baby and they were from this particular culture, we would hang a little colored drop on the outside of their door to let us know that it was this particular culture. The family was behind this door, this particular culture. So that, because they had a very specific do not compliment or praise the brand new baby, because their culture believed that that was a spiritual offense.
Oh, wow.
And so
Yeah, interesting.
and normally everybody goes in, they're like, oh, what a cute little baby. How
Yeah.
cute you
Oh
must
my
be. And
gosh.
then you just basically curse the whole entire lineage
Oh
of your family.
my God.
And so that's important, is to recognize
Yes.
that every culture has their own view around childbirth. And this is part of that trauma-informed care that's inherent to nursing, which is why I find having to educate nurses, yoga teachers, yoga therapists on what does trauma-informed yoga look like? Well, it means having language that is inclusive. It's honest, it's kind, it's compassionate. It is allowing for a person's experience to exist. And this is the component of yoga that I absolutely love, because we have so many examples of this in nursing. Two things can be true at the same time. You can be going through the absolute worst scenario of life and also finding moments of joy, whimsy, gratitude, stillness. It doesn't mean that, have to be excited. This is not the toxic positivity where, okay, you're going through a cancer journey. How do you find something great to be grateful about in this moment?
Yeah.
Right? It's that ability to sit there and say, this really sucks. I don't like that I'm having to go through this. It's brought me and my family together, and we're getting that time to be together and to have these moments that we will always remember. We're also having these moments where we get to sit here and laugh about something in the middle of a really sucky event, and both things can be true at the same time. And this is that duality that yoga teaches can exist, because we have a lot of times where we think, I should be happy that this is happening, and at the same time I'm grieving something else, and they can coexist at the same time. And that can be very challenging, because we think, I can only be happy or sad. I can't be both at the same time. And this
but you
allows for
can.
that space. Yeah. And then when yoga comes in and says, but you can. So it's okay. And we experience a spectrum of emotions all at the same time. And we've all had this where, we're in the midst of a very chaotic event, and also being excited that we've got this particular doctor running the code. We've got this particular respiratory therapist. We've got this hospital administrator. We can be happy that we've got this team of people that are here, while also being very focused and wanting to get a good outcome for this patient, and also being nervous because we're like, I'm hoping that this goes the right way, right? I'm hoping that we're successful in this. All of those emotions are all happening at the same time. They're all layered on top of each other.
Yes.
And when we step away from that moment, it's taking that time to just, okay, let all of those emotions settle in for a second. And then what do you need to do to process and integrate all of that? And that trauma-informed component is, what does my nervous system need right now? What is my nervous system? How is my nervous system? What is my capacity in this moment? And so trauma-informed care isn't about, you have to have trauma in order to be in trauma-informed yoga. It's recognizing that everybody is navigating a different version of their nervous system, and where are you in that spectrum, and what resources do you need? And so there's a lot of ways that this can be utilized. I've been working with a nonprofit, and I've done a lot of work here in San Antonio with Fort Sam Houston, with the Army, with the military, with nonprofits that focus on adaptive cycling for veterans and first responders with PTSD. And I think that's really helped me in learning how to apply yoga, how to apply the neuroscience, how to understand how does this show up in everyday life, and then how do we take yoga practices and make them very you specific, not so that we're wrapping you up in bubble wrap and you never have to, feel triggered or feel anxiety or feel anger, but instead, how do you recognize, this is the nurse example of it. If you've ever come home and you walked into your house and the dishes are sitting in the sink and the garbage is overflowing and the laundry is half out of the washer, and you walk into the house and you lose your crap because you're saying, all you're thinking is, am I the only one that ever does anything around here? How can you people possibly do this to me? Do you know the stuff that I've had to do at work today? And you lose it. Not because you don't love your family, not because that state of the house is the problem. It's that it was that one last little tiny thing. All the other things,
the last straw,
the nervous system, and that was the thing. That was the last straw. And instead, being able to walk in, look at it, and go, "I'm not dealing with this. I'm going to bed, and y'all are dealing with this. I'll see you in 8 hours when I wake up." And honestly, this saved my marriage, because now when I feel myself getting all amped up and I feel myself about to lose it, I can look at my husband and say,
deep breath,
"I'm going to go for a walk and I'll come back." Or, "If you like your arms, feed me before we have this conversation." And he completely gets it, but then in turn, he can do the same thing. He can say, "Now is not the time for this conversation. Can we have this after tomorrow when I've slept?" And it's learning to recognize, okay, I have the capacity to be able to have this conversation. And this is where we really apply it in our everyday lives with those boundaries that we talk about, by asking the question, do you have the bandwidth for me to vent for a moment? And if somebody says yes, okay. And then they're recognizing this has nothing to do with me. They just need to get this out. And then asking the question, do you want solutions? Do you want me to fix anything? Do you want me to offer advice? Or do you want me to just listen? And this is the component in nursing that I think a lot of us forget about, is advocating for our patients isn't telling them what to do. It's educating them on all of the possibilities that are available, and letting them make the choice, and recognizing that even if they make a choice that we're not really excited about, it's their choice. And the big space where this is I'm going to stand on the soapbox for a moment, the conversations where we ask people, do you feel safe at home? Are you experiencing any abuse? Are you thinking of harming yourself or anybody else? Take the moment to look the person in the eye, because I've had this happen to me as a patient, where the nurse has turned and on the computer, do you feel safe at home? Are you thinking of harming yourself? Meanwhile, did the person make that? No, I'm good.
You don't know the expressions on their faces or their body language.
Exactly.
Anything like that.
As a nurse, those questions are where we're gathering so much information about where is this patient in terms of basic Maslow's hierarchy. Do they feel safe? Do they feel stable? Do they have food, clothing, shelter? Do they feel safe in their own home? And that's an opportunity that can really honestly get missed a lot. And if we're missing that important piece, what else are we missing? Because we're not taking that moment. And I'm not shaming, blaming, judging nurses in any way, because I'm well aware that in the midst of a code, we're getting asked, did you fill out your whiteboard?
Yeah. Oh gosh, yes.
I'm
Well,
recognizing.
Thank you, Eva, for joining us again today. So please, Eva has a lot to share, and go to her yoga for non-bendy people, and she can help you with a lot more, and me too. So anyway, Eva, I want to thank you for joining us again, but I want you to come back another time, please, one more time, because
Absolutely.
so I know that you're a CE provider, and I know that you incorporate your CE provider with your yoga practice. And so I want you to, share with us some of the other topics that you have. Yay. So please come and join us again on Monday. I don't know if it's going to be next Monday, but we're going to have her back on a Monday at 10 a.m. So just subscribe on YouTube so that you don't miss an episode, because we are breaking burnout here.
Yes. Thank you so much, Bonnie.
You're so awesome.